breastfeeding is becoming more and more popular. Doctors say it's the way to go, and it's certainly the most preferred by physicians. However, there's some women who choose not to breastfeed because they lack the support, and that is changing now thanks to a grant from the Blue and You Foundation. So joining us this morning to tell us how it all works is Jessica Donahue. She is a registered nurse and a lactation consultant with Baptist Health. Good to see you.
Good morning. Thanks for having me.
Let's talk a little bit about how Baptist Health is helping increase breastfeeding rates, because it is the best for the baby.
It is the best for the baby, and right now the Arkansas Department of Health is on a campaign to raise the breastfeeding rates 10% over the next 3 years. For years, Baptist Health has had a telephone line where moms can call and talk to one of our nurse lactation consultants. We also do outpatient appointments. We have support groups. But what we've done this year with the grant from Blue and You is we've developed a telehealth lactation consulting program.
Okay, technology is a great thing, especially when it can help us be more healthy.
Right, technology is a great thing, and so what we're able to do now is, let's say you deliver a baby at Baptist Health Stuttgart,
okay,
or Baptist Health Arkadelphia. Those are the two that we have set up, the two hospitals that we have set up right now. A mom in the hospital is going to get great postpartum care from her nurses.
Right.
But if breastfeeding isn't going well and she needs the help of a lactation consultant, a nurse can now take an iPad, which I'm holding right here, down to the bedside, and they can consult with us in Little Rock without any problem at all.
That is wonderful. I think we've got some pictures kind of showing us a little bit about how this works. So if they can't make it to Little Rock to get this consulting, it can happen right there.
It can.
On their iPad.
And it also extends into the outpatient area as well. So the mom goes home from the hospital and she lives in Arkansas County or Clark County or some rural county. She would normally have to travel to Little Rock if she actually wanted to come to our support group,
right,
or she wanted to get an outpatient appointment. Now we can coordinate care with the Arkansas Department of Health, the local health units. All a mom has to do is drive to her health unit, and then she can see us in Little Rock with no travel.
She can still have her privacy with this, right?
It's very private. That's one of the things that we want to get across, is that new moms today, younger moms, are the iPad and smartphone. That's how they solve lots of problems.
Sure.
And so to them, it's very simple. But this is not Skype. It is not FaceTime. It's HIPAA compliant, and it's completely private.
Okay.
So she doesn't have any worries about that. Going forward, right now, it's just hospital to hospital and health unit for outpatient and support groups. But going forward, we will be able to have moms use their own tablet or smartphone and consult with us from home.
Actually do it from home.
Yes.
You know, because they go home and they got a lot of information at the hospital, but
Correct.
maybe they forget it all, or they have more questions after they get home.
Most of the questions come after you
Right.
go home.
Yeah.
So they'll get good care in the hospital, and then they go home, and without the right support, and there's lots of different varieties of support. Not every mom needs a lactation consultant, an expert in breastfeeding. Breastfeeding is not hard. We tell people that all the time. There is a learning curve, mostly for first-time moms.
Right.
But even our support group, where other moms get together and answer questions for each other, that's a form of support that we're now going to be able to deliver without travel.
Oh, wonderful. Okay, so how can new moms access the service right now?
Right now, what they need to do is call our warm line, 202-7378, or they can call the Baptist Health Line, and they can get information. Currently, we have the program up and running at Baptist Health Arkadelphia, Baptist Health Stuttgart, and then we are working with the local health units. We do plan to add several hospitals going forward.
Very good.
One more benefit that we didn't really see coming, we got this generous grant from the Blue and You Foundation, but one real benefit to it as well that we've found that isn't directly related to breastfeeding, but it's been wonderful, is if a mom delivers her baby in one of those examples of rural counties, and her infant is transported to our NICU, to our intensive care unit, she can see her baby before she leaves.
Right.
So she can recover where she is, but she can see her baby, talk to her nurses, meet their caregivers, and so it's been a wonderful program that we're helping.
Another program with technology, and there could be more and more of more programs that are done with an iPad.
Well, actually, there's lots of telehealth programs out there now, and Baptist Health is the first one to use it for new moms and helping raise our breastfeeding rates.
Because they have lots of questions.
They do.
Okay, thank you so much.
Thank
and we want to remind you, of course, about Baptist Health. If you have any questions, the Baptist Health Helpline is the way to go as well, 1-800-BAPTIST, and they can certainly get you to where you need to be. Thank you so much.
Thanks for having me.
Exciting stuff.
Yeah.